many of you don't even realize how high your cholesterol can be. You know what? It is Rally for Red Day here on Snore Living, and we, along with Mayo Clinic, we want to keep you heart healthy. And today we're talking about extreme high cholesterol. And if you have high cholesterol, chances are you may have inherited it, and chances are you're passing it along. I want you to meet Dr. Regis Fernandez. He is a Mayo Clinic cardiologist, and he's really here to explain how it affects young people more and more, and some fascinating statistics that you were telling me, Dr. Fernandez. First of all, welcome to Sonora Living.
Thank you, Terry.
Welcome
Good
to the Valley of the Sun as
Thank
well. Let's talk about what type of cholesterol we're talking. We're going to call it FH for short. What do you call it?
So familial hypercholesterolemia is the name of the condition. Familial because it comes from family. It's a genetic disorder. You inherited it. Hyper means high. Cholesterol and lemia means in the blood. So it means high cholesterol in the blood that comes from your family. That's what it's called, but we're going to call FH for short.
FH, thank you, because I cannot say that all morning long. So we are basically talking about the difference between just living a bad lifestyle and making bad choices and getting high cholesterol versus being born with it. And you say the problem is that if you're born with it, you may not know it until it's too late.
Correct. You don't know because it's a very common problem, by the way. About every 1 out of 250 birds have it. So if you look at these statistics on this way, one baby is born with this every minute in the world. There are about 35 million people in the world that have the condition, and the majority don't know.
And here's the problem that you're telling us is that because you don't know, young people are dying of heart disease and heart attacks at a very young age.
Correct. The first symptom of this condition could be a heart attack or a death in a family in somebody age 50 or younger, which is devastating for families because it happens at the prime of their lives.
And this is a startling statistic right here. Do you see this right here? This could be a 10-year-old child. And this is a normal artery right here. This could be a 10-year-old child whose family history is cholesterol.
Correct. Of the 35 million people worldwide, about 20% are children and adolescents with the condition.
That is startling. Okay, so we have a simple chart here for you to kind of look at and realize that this is a growing problem, and it's somewhat of an epidemic because people aren't getting tested.
Correct.
So what are you recommending that people do? I mean, do we look at our family history, ask questions, and then get tested at a very young age?
So knowing the family history is critical. Knowing that 50% of your offspring can be affected if you have it. So that's the critical point.
50%?
50%. So there's a chart in there that shows that if one of the parents is affected, the children has a 50% chance of having it. So, and you carry that all life long. You can see that the color showing.
Yeah, bring up the other one if you can for us, because that's really this is the critical point where if you have this in your family history, you're saying even babies, even young people should be getting cholesterol tested.
Yes, because this cholesterol buildup in the arteries is a lifetime process. Your risk of a heart attack is a lifetime risk, and there's a 20-fold increase in the risk in people that have this condition versus other people that don't.
Right. Well, here's the good news. It's treatable.
Yes. It's treatable. You can start treating at a young age. Even children can be treated either with medications or with lifestyle changes, but you start early so you don't develop the process at a later age. You don't want to find that out in your middle age or in your adult age. You want to find it early. That's the key for prevention.
Yes, you don't want to find out after it's too late.
Correct.
Dr. Fernandez, thank you so much. Really good information. And if you'd like to make an appointment with a Mayo Clinic cardiologist to learn more, you can call the number right there on your screen. It's 480-301-8200. Lots of great information as well at mayoclinic.org. And as always, here at ABC 15, don't forget, we team up with Mayo Clinic for our Rally for Red campaign. Each month, we're going to give you easy-to-follow recipes and ideas to help keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.